UAB, as part of the Reproductive Medicine Network, which is sponsored by the National Institutes of Health, has been part of two landmark trials recently, one of which was released today. Those trials ask the basic question is, how should you treat women who are unable to get pregnant, either for those who are not ovulating regularly, so they have ovulation problems or ovulatory disorders, and even a more daunting question, how do you treat couples who are not able to get pregnant or who aren't getting pregnant on their own, and we can find no reason for their infertility, so the unexplained infertility group. The first trial, which was published in the New England Journal of Medicine last year, demonstrated for women that have polycystic ovarian syndrome. They don't ovulate regularly. They have hormone imbalance, which is excess hair growth, things such as that, are much more likely to get pregnant if you give an aromatase inhibitor, a drug called letrozole, brand name Femara, to induce ovulation. Previously, other medications were used, and this trial showed that the side effects were less, and you were 44% more likely to take home a baby with letrozole or Femara than with traditional treatments. So landmark in that it changed how basic infertility associated with anovulation and polycystic ovarian syndrome was treated. The follow-up trial, also a multi-center trial involving almost 900 patients that UAB was a part of, a very select group, addressed those patients with unexplained infertility. So normal, male, ovulating regularly, and simply put, the plumbing is normal, the uterus and fallopian tubes. And what we found in that case was that when we compared the traditional fertility tablets, clomiphene citrate, versus the newer medication, letrozole or Femara, versus injectable medications, so these are fertility injections, that the Clomid had a significantly better pregnancy rate and a lower complication rate than the other two. It also brought up the important question that our goal with fertility treatment is to have the woman have a healthy singleton pregnancy and avoid the risk of multiples. The trial was actually called AMIGOS, Assessment of Multiples in Ovulation Induction, or AMIGOS. An interesting finding was that if you took the fertility injections, you had about a 1 in 3 chance of getting pregnant, but you also had a 1 in 3 chance of having a multiple pregnancy. So many would say that the risk is quite high and the benefit may not be worth it. The take-home message from a trial that will change how OBGYNs and fertility doctors practice is that if you're already ovulating, clomiphene citrate is a better drug. And if you're going to use fertility injections, you must do a very careful assessment. Is it worth the risk of having multiples? UAB was very fortunate to be a crucial part of this trial. In fact, the only medical center in the Southeast that participated, enrolled patients, and contributed data through our association with the Reproductive Medicine Network. So for us, it's very satisfying that we can contribute to landmark research that can benefit patients the world over, and not just here at home in Alabama. UAB's participation in these two landmark trials to the Reproductive Medicine Network really highlight the fact that that fertility should be individualized, that not every patient deserves the same treatment, and that having cutting-edge treatment makes a difference in the woman's ability, the couple's ability to expand their family and take home a healthy baby.